Hello, welcome again to On the Mic with Mike. I am Mike Jarvis, and in this edition of the podcast, I am joined by Clinical Specialist Sonographer Sonia Charles of Montserrat, president of the Pink Ribbon Charity Montserrat, and also who has performed her specialist skill in her specialist medical profession in the UK, in the Middle East, in Dubai. Sonographer Charles, welcome to the podcast.
Thank you. Thank you, Mike. It's indeed a pleasure. Absolutely a pleasure indeed. Yeah.
And you notice I was a little bit hesitant in getting the terminology of your profession right. So, who or what exactly is a clinical specialist sonographer? What do you do?
Essentially, a sonography came out of the radiology, sort of like mother of imaging. And it's just one modality, which is ultrasound. And a radiographer can train to be a sonographer, can train to operate mammography, CT scan, MRI. And my specialty, I chose to focus on um, ultrasound, which everyone knows can do many things from pregnancy to the abdomen for the kidneys and the liver and blood vessels and lots of other things. So that's my core profession. But I also have had the opportunity to be a radiology manager where I've managed all modalities, including MRI, CT, mammography, X rays, and ultrasound. So, as a radiographer, you have the ability to, because of the training, you have the ability as a radiology manager to be able to manage individuals in these particular disciplines.
And you've been doing this for quite a while.
Started on Montserrat, remember? That was in 1982 when I went off to study and qualified in 85, 86. And yes, so from about 86 until now, I'm still actively practicing. I have, in fact, done quite a bit of research. I've had research roles and also have had teaching academic roles. So I've split myself over the years in doing different aspects of radiology.
Yes,
Yeah.
I was just about to say, and in line with that, you've brought your very broad, internationally recognized specialist skills to Montserrat. You've set up the Pink Ribbon Charity. So you're very much involved. And I just want to take a cue from that and go directly to an article that you produced a few weeks back, sometime in February. I remember, looking at it and also making some comments, doing something across that as well. And I'd like to develop that with you for the purposes of this particular edition, because in that article, I think it appeared initially, you had it on Discover Montserrat, you pointed to some issues surrounding the provision of the services that you provide and the medical equipment, the very precise medical equipment that goes into the work of a sonographer, the work of a radiologist, and given the needs, the health needs that we've heard about in Montserrat and we keep hearing about time and time again, your article addressed that. What's the issues surrounding there as you are developing them?
Well, with my experience, as you just mentioned, my experience in radiology, it was essential that I had a look way back as early as 2022 to see what was going on with the pitch and the move and the urgency to bring advanced technology in medical imaging to Montserrat. And having myself been involved in bringing imaging diagnosis, easy diagnosis via ultrasound, I knew that there were a number of parameters that had to be in place, in particular when looking at mammography and CT scan. Ultrasound was easy because it's a modality that does not require a radiologist because the majority of sonographers, in particular like myself and those on the island, have the ability to scan and interpret and write a report from the images that they have acquired. On the flip side, mammography and CT scan require, because it is radiation emitting equipment, it requires a radiologist to supervise and to be there to support the individuals who are operating the equipment and also to report the images. Now, that support is essential because it also, Mike, is not just for the persons operating the equipment, but it's also for the doctors who are referring and treating. And we have what is called a multidisciplinary setup in wherever you work in the world. And Montserrat has it as a different level of service, but multidisciplinary care is is what's the best care for the patient, where every doctor, every professional that's involved in the diagnosis, in the referral, first of all, diagnosis and treatment of the patient must be able to collaborate. And that collaboration brings excellent patient care.
Now, I
My,
know let me just jump in here. Sorry. I know that there's been quite a lot of talk about the need for specialist medical equipment in Montserrat. There's a lot of talk surrounding, well, finally, hopefully at last, we're getting a new hospital, but it needs to be equipped and it needs to be properly staffed if the issues surrounding healthcare delivery are going to be addressed in Montserrat. And from this conversation with you, particularly in your area of expertise. What do we need to have in place and how urgent is it then from your perspective?
with reference back to the article, and I urge individuals who have not read it to locate it, and I hope that we can put a link adjacent to what we're doing today, because the article clearly states, and I was very much aware that a radiologist is an essential um, element to the radiology service being delivered on Montserrat. I'm very much aware that the equipment has already arrived before the radiologist. So that's the cart before the horse, and that's okay. The cart came before the horse, and that's okay. But there must be a better understanding of the value that a radiologist resident on Montserrat can bring to the delivery of radiology services on an island as small as Montserrat. It could be said, possibly said, that we are a small population. Why do we need a resident radiologist? We need one because we have high value capital equipment. We have high value radiation emitting equipment. We have high value equipment that will produce excellent pictures, excellent diagnosis. We need to have a radiologist on Montserrat. Mike, it's also possible that there could be a challenge to say, well, we don't have enough work. But if we didn't have enough work, why do we have the equipment?
Good point.
So that's a no, that cannot be even entertained. We, because we have the equipment, we are encouraging doctors on the island and maybe even neighboring islands to access our services on Montserrat. The persons operating the equipment, and this was indicated in my article, must be academically and clinically trained to be able to support the radiologists and the referring and treating doctors. It's a whole it's a whole algorithm. You cannot, you miss one part of it and you're venturing into a dark hole. And I think that yes, we have a situation where the equipment is already on island. So I'm urging those responsible for the procurement, installation, and now actively being used to look at the safety issues, look at the individuals who are reporting this on the teleradiology system. They are not on Montserrat. What do we need out of our mammography and CT scan equipment? What are we hoping to achieve by buying these expensive equipment? Are we saying that even if you have teleradiology today, what is your plan for the next 6 months to a year? Long before the hospital is built. It's not going to be built in 1 year, Mike, and not 2 years either. So what are we going to do? Pay for teleradiology when you can, in fact, employ a radiologist to be on island, and that radiologist, Mike, will have enough work to do because every X-ray that is taken on Montserrat should be reported by a radiologist. This is 2025. Back in 1986, I understand that because I just returned back to Montserrat. We're in 2025 now. Why are reporting of X-rays being given to the doctors? It's not in their remit. It's not in their training. It's
Are
not
you, yes, are you saying then that that is putting too much of a burden on the doctors in addition to everything else that they have to do?
absolutely, absolutely, absolutely. But because they have done it all these years, they have done it, and it's been accepted that the X-ray is taken, give it to the doctor. Yes, the doctor, because as part of your training as a medical physician, you work in the emergency, you work in a clinic, you're seeing X-rays. Yes, you know where things are, you know when things are wrong, but it's not your remit. It is not your training. And the liability that comes along with missing a fracture or missing something falls with the persons who are in charge of the doctors.
Should I
But
interpret that then? Should I interpret that then that it makes the case or it amplifies the case to have persons with particular specialisms, which we have in the medical field anyway, but in this particular situation, the importance
definitely,
of having clinical specialist sonographers such as yourself or radiologists such as yourself in that situation, irrespective of the size of the population.
indeed, and the whole idea with this for this chat is to emphasize the importance of a radiologist. The radiologist is an essential part of a radiology department. And in 2025, a radiology department, especially on an island like Montserrat that's supported by British funds, should not be running a department with a mammography and CT machine without a radiologist on Montserrat. There is enough work. Even if he does one CT a week, that's enough work for him because that's why the machine was bought. The machine was not bought to do 10 or 100 CT scans a week. That is not the population or the sort of like the illness rate that we have on Montserrat. We don't have road traffic accidents every half an hour. So we are very much aware, Mike, even before buying the machine, both mammography and CT scan, that the volumes were going to be low. But teleradiology is not the answer. A radiologist on island with good skills, strong skills in scanning, so he can support the sonographers for the advanced imaging to be done with ultrasound, because not everybody can have every skill. I am a clinical specialist sonographer. I am not skilled in everything. Even after 30 years, I am not. So I don't expect everybody to be skilled. But if you have a radiologist, he has and would have covered in his training a significant amount of radiology imaging in all modalities. And that is the person that is required to be on Montserrat so that individuals do not have to run over to Antigua even after having the CT scan or mammography done.
I, s-
That person must be able to support the doctors with their referrals, telling them exactly what to order, discussing the results, and also discussing treatment plans. This is the person that is required, a radiologist.
so
Very important.
there's a cost and there's a practicality aspect to it. How does this affect you? You go to Montserrat from time to time, between your engagements elsewhere, and you to take part in the visiting medical experts program.
Well,
How does what you're talking about, yeah, how does what you're talking about here affect you when you go to Montserrat to perform your expert services?
Well, in fact, I'm not part of the visiting specialist program. When I go to Montserrat, I have been performing outside the visiting specialist program for
Okay,
many
okay.
reasons. Yeah, right. So the last 15 years or so, I have done a lot of ultrasound, but it was never part of the visiting specialist program because that was geared mainly for specialist doctors coming and performing services that were not available on Montserrat. What I do is basically ultrasound, and once the resident sonographers were on island, I focused my specialism in vascular ultrasound. And many times, if things are found, patients cannot be treated on Montserrat. But if you had a radiologist, they may be able to get those treatment plans arranged or discussed on island before leaving the island. So the services that are rendered on Montserrat in radiology, in particular mammography and CT scan, must be managed and supervised by a radiologist.
Well, I know that we've had the authorities in Montserrat consistently expressing concerns about the challenges that they are having in healthcare delivery and the efforts being made to resolve that situation. But given the particular area that you're focusing on at the moment, it appears to be quite an urgent matter that warrants to be dealt with. What do we do from here? Where do we go from here?
Well, the message is clear that it's a safety issue. And when it comes to safety, individuals who are working within radiology understand that word safety in radiology is very important.
Okay, can I just
And
interject here quickly? Safety for whom? Safety for the doctor, safety for the staff, safety for the patient, or all of them?
for everyone. Because, number one, Mike, your equipment has to be supervised. The use of the equipment has to be supervised. The maintenance of the equipment has to be supervised. You have to have regular preventative maintenance, not by the vendor only. You have an independent person that would come and review the equipment every 6 months. So those parameters, once those parameters are in place, you know that your equipment use, and it doesn't matter whether you have one patient or no patient, the equipment must go through preventative maintenance and some element of corrective maintenance if necessary. But if you do not have a radiologist and you just have a technologist or radiographer alone, it's a big burden, Mike. It's a huge burden to expect um, a place like Montserrat without a radiologist to be there to monitor, do documentation, do safety checks, do quality control, do all of that. It's a tremendous burden. So you need that radiologist who would be the person with the training also and the experience to know, well, can I see your QA? What is your quality control for last month? Can I see can I see this? Can I see this? And these individuals, because of their training, they know what to ask for. They
You,
know they know exactly what to do in terms of asking for the because he's the doctor in charge. The technologist does not have as much a voice as the doctor in charge, and that we know that culturally.
you mentioned training quite a bit there, and I just want to touch on that. In terms of the training that's required, how long does it take to train a radiologist, or it's a radiologist, a radiographer? I just want to make sure that
Radiographer,
I,
radiographer.
okay, that I have the terminology correct. So,
Yeah.
how long does it take to train a radiographer? And if I'm purchasing a particular bit of equipment, yes, expensive, sensitive equipment, delicate equipment, necessary equipment, could I be trained to operate the equipment while I'm purchasing the equipment from whomever the supplier might be, or does it require specialist training beyond that?
What happens with equipment such as mammography and CT scan, Mike, is that the vendor will always, and as per regulations, international regulations, the vendor must provide a hands-on training to look at the buttons of the machine. That's all they do. They show you where the buttons are, what to press, what to push, and they don't spend more than 2 days to maximum maybe 7 days in a lot of countries outside Europe and the US. In Europe and the US, they are mandated by organizations and health authorities to be in the facility for longer, but this is not considered academic or clinical training. This is equipment applications only. So equipment applications is completely different to clinical and academic training, which for mammography is about a year. For CT scan, it's also about a year. That's a 2 year training with hospital attachment, with classroom assignments, with academic training and exams and final certification. Once you have that, when the clinical applications arrive for the new equipment, you would have already been introduced to these modalities at an academic and clinical level.
How long does it take to have that training done at the level that you're indicating, or even at the basic level, to put it that way?
But the basic is the fundamental training, which is 1 year for mammography and 1 year for CT, a year and 4 months, year and 2 months. It depends on the institution and it depends on where you are, whether you're in the US or you're in the UK. But you're looking at about 2 years to 2.5 combined for mammography and CT for a radiographer. The radiologist training is a long training, and we're not going to train him. We're not going to, because he's already trained. He's coming with his skills. He's already a doctor with postgraduate training and some clinical experience under his belt, so he can perform independent of having to do any additional training.
So is that saying that there's someone on the way already, or is there still that void to be filled?
To the best of my knowledge, I don't know if anyone has been trained, has left the island to be trained in recent times. But I know when I inquired at the up to 6, 7 months ago, to the best of my knowledge, I was not told anything different, and that's the reason why I asked when would a radiologist be coming, and I was told that there was teleradiology, and that will suffice.
But in an era where there's so much emphasis on technology and AI and robotics, is that in the case of Montserrat, given the quote unquote limitations, and I think a term that's been bandied about quite a bit is um, lack of capacity. Is that satisfactory in this situation?
Well,
Could we survive on that? Could we
uh,
get by
teleradi-
on that?
teleradiology is well, it's documented as part of, and people get it confused with telemedicine. Telemedicine is something completely different. Telemedicine is me sitting in my living room and paying to see a doctor halfway around the world who speaks to me on Zoom or a network linked with the clinical hospital. That's telemedicine. I'm getting a consultation face to face, but online over the internet. Teleradiology means that the images taken on Montserrat are sent via a network system to another country, another location out of Montserrat, and they appear on a monitor or computer on the desk of this individual who will open his computer and see our images, report them, and send the report back to Montserrat over maybe an hour, 2 hours, 3 days, one day. I don't have any idea what their arrangements are, but that is what teleradiology is all about. The problem with teleradiology, Mike, is huge because there are thousands of teleradiology company out there, and they should go through a quality check. They should also make sure that their doctors are practicing the way teleradiology should be practiced. And that means that these individuals must have a certain level of qualification at the top of their game, so to speak. The qualifications of those individuals must be made known to the individuals receiving the service. So I am having an X ray or CT or mammography on Montserrat, I should know who is this person reporting my CT scan? Where is he? Is he in Europe? Is he in Africa? Is he in India? Is he in Asia? Where is this person? What is his qualification? Where was he trained? What does he do on a daily basis? Is he retired and sitting on the beach with a laptop? Is he actively working with patients on a daily basis? Is he in a acute care hospital seeing acute patients? Or is he in a private practice seeing generally normal patients who are ill, yes, but not critically ill? What is he doing? Has he had his professional license updated recently? These are all the parameters that must be taken into consideration, Mike, before a teleradiology service is set up. Maybe they have been taken into consideration, but my point is this service is not suitable for Montserrat because it is remote. Even if you can pick up the phone and speak to the doctor, it is not the same. Montserrat is too small to be using teleradiology, especially, especially when you have already bought high value, high value equipment for use on the island.
And that brings me to another point. I mentioned before, it's finally, and everyone goes, finally, it seems as though the new hospital construction of that is getting on the way, something is happening, and that in and of itself is good news. But as you said, the equipment is already there. Having a bit of an understanding of how some delicate technical equipment operates, um, you mentioned cart before the horse before, but we have the equipment there. So if the hospital is being built, is the hospital being built around the equipment, or will the equipment have to be moved and then put into the hospital compound once construction is finished? And uh, does that risk compromising these very delicate bits and pieces of kit equipment?
I have absolutely no idea about whether it will be moved or whether it will stay where it is. But what I do know, Mike, is that construction involves noise, involves movement, involves vibrations, involves a lot of things. You and I know that. And my concern again is the purchase and the procurement and installation and use of the machine before the hospital has been built. There's absolutely no reason why this purchase could not have waited until the building was built. There's absolutely no rush for it. The population is 4,000. Somebody needs a CT scan. They were going to Antigua or other islands before, they can continue going there. If you do not have the appropriate individuals, manpower to deliver this service, all you have to do is wait. There's absolutely no reason for this to be rushed as it was rushed, installed, and now there's no radiologist. I don't think that the persons who were involved understood that a radiologist was important and that should have been budgeted for. But teleradiology, Mike, comes at a very high cost, a very high cost, and I
So
think that, I think the cost of teleradiology, I have no idea what it is, but I don't think it's cheap. Well, it should be cheap if it's procured properly, but it's not a cheap option. It's not.
So cost, practicalities, value for money all come into play, but we are where we are at the moment. So if you were to offer some advice to the authorities in Montserrat concerning what we've been discussing here, what would be your recommendation? Would it be to have a radiographer, am I correct there,
A
on island?
radiologist,
A
radiologist.
radiologist, have a radiologist on island.
I think the first step, Mike, is for them to understand the reason why I'm asking for a radiologist. And it's not just to bring an expensive doctor on island because he's going to be, he's not a cheap option. but you have the equipment, so you need to have him. And then you need to get the staff, trained in CT and mammography, academic and clinical training within a university. This is essential, Mike, because they will have to support the radiologist. So the call on the article is for a radiologist and for academic and clinical training to be undertaken in order for this readiness. There is something called, Mike, called radiology readiness. And it's a long checklist. That readiness involves making sure that your manpower is adequately equipped from the radiologist all the way down to your person who comes and checks the machine every 6 months, your equipment engineer. All those things have to be in place because if they're not in place, you're not delivering a safe service. The
So
service must be safe in order to deliver.
the parallel that's ticking around in my head as we come to the end of this little conversation here is, and it's pretty basic, saying that we've been talking so much about access in Montserrat, blah, 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 blah. It's like saying, okay, so here I am. I've got an aircraft that could fly from Montserrat to, I don't know, New York or wherever, but the technical capabilities and the qualification it takes to have someone doing that. The folks I have, they can only fly, they're only authorized to fly from Montserrat to Antigua. So I'm not getting the value out of that aircraft, out of that, the potential of that service. Is that a proper way of looking at it?
I, I possibly. But again, Mike, it goes back to what I said earlier that individuals must understand who a radiologist is. Same like a pilot being trained at a higher level to fly the small two-seater or to fly a bigger 747. Or I'm not even going to go to the other larger planes. There are different training levels that you have. And for me, the radiologist is a key component to the delivery of safe radiology on Montserrat, to the delivery of a service that is going to benefit the entire population, and also to ensure that this person, when he comes on island, will not just be supporting the doctors, but he can also refer patients out of Montserrat for care and be the contact person for imaging on Montserrat.
Would that also
No,
suggest, sorry, would that also suggest that if all of that were in place, we could have Montserrat as a center to deliver that caliber, the quality of service for people in, say, neighboring islands?
absolutely, because nobody wants to come to Montserrat to do a CT scan to know that their report is going somewhere around the world and they can't pick up the phone and speak to this doctor. And even if they do, it'll cost them an international call. Nobody wants that. And persons who are having the CT scan and the mammography, they are not aware about who is actually reporting this thing and where are these individuals working? Who are they? Why have we not been told who these individuals are? Who are the people involved in the teleradiology service? Why has it been kept a secret? Why is it that the names and qualifications and locations and working locations, wherever they are, because, Mike, there are a lot of people, a lot of patients who are not aware of the intricacies of teleradiology. They are happy to get the service, but if something happens, something goes wrong, who is actually responsible? Who is that person? What parameters have been put in place to give the patient that safety net if something happens?
Well, one would only hopefully assume then that the authorities in Montserrat would have had all of that in place because issues of insurance come into the picture. I don't want to talk about malpractice per se, if that should come in, arise, but there's also that as well. So one can only assume that all of those guardrails, to put it that way, are in place. So Your concerns have been stated as reflected also in that article that was in Discover Montserrat a few weeks back, and you've voiced them here again. So one can only hope that based on your expertise, your professional background, that what you've highlighted here is being addressed or will be addressed going forward. Because as you stated quite clearly there, the equipment is already on island.
That's correct. And I think the urgency is there for a radiologist to be employed and to ensure that individuals who are delivering the service are academic and clinically trained. Those are the 3 points, Mike. And I think that those concerned will be very much aware that they already know that this is that this is needed. Teleradiology was an option that had to be put in place because the equipment was already on island. And you cannot recruit a radiologist by the snap of a finger. It takes a really good HR person to recruit an appropriately trained radiologist who is effective enough to support the radiography team on island.
Well, looking at this situation that we've been discussing here, it's obvious to me that, and I think to anyone else, that we've had sensitive medical equipment in Montserrat before. We've had hospitals, we've built and rebuilt hospitals, etc. So, what makes this current situation and the issues that you've raised different now as opposed to what we might have had back in the day?
There are actually um, similarities in what I have been discussing and what was in the article that was published. And the similarity exists because about 10, 14, maybe 14 years ago, 13, 14 years ago, an ultrasound machine was bought for the hospital and it arrived. And once it was on island, there was no one trained in ultrasound at the level that was required to give the service. And the machine stayed in the hospital, not being used by anyone employed by the government of Montserrat. And during that time, being a trained clinical specialist sonographer and realizing that there was a need for this service and the equipment was there, I volunteered to travel from the UK several times a year over, I think, a 2 year period until the individual that was sent to train returned to Montserrat following an extensive training abroad. And all this might happen after the equipment was purchased. So there are stark similarities between what I've just discussed and what I've been discussing for quite a long time, actually, and what we've spoken about with reference to what I just mentioned about an ultrasound machine being bought way back then, more than 13, 14 years ago. And we have a similar situation with the mammogram and CT scan machine being on island, installed, and in use without the appropriately trained individuals and someone to supervise those individuals in the name of a radiologist.
One could only think that, given the example that you mentioned, that we would have learned from that, or have we
It's
not?
it is difficult to say because there has to be a fundamental understanding of what we are delivering to the public. And we can't just deliver a shiny piece of equipment to the public and say, well, we have a new service. It's a very it's only half done. The bread is only half baked. And I think that there must be a level of understanding that when you deliver service with diagnostic services with an equipment, not manpower, with an equipment, you must have the adequately trained academic and clinically trained individuals to operate those equipment and deliver the service. And the ultrasound equipment back in about 14 years ago is a very good example, a reference example that I can refer to. And it has been referred to on many platforms as one of the sort of indications that individuals who are purchasing equipment are unaware of what we need to be in place either prior to the equipment arriving or at the same time that the equipment is being installed for use. This is very crucial. We're not talking about a balloon pump to blow up a balloon for a party, where if the balloon pump goes, you can blow it with your mouth. No, we are talking about critical equipment, life-saving equipment for patients. And this is my concern as a qualified radiographer, clinical sonographer, radiology manager, and all that put together over nearly 30 years, that I can come to you on this platform and say, we need to do better. We need to deliver to the people of Montserrat a better service, a more robust service, deliver with the understanding that having adequately clinical and academically trained persons with supervision is essential. And the mistakes made way back 14 years ago, I'm assuming no one remember what happened, but I hope not. I really do.
And finally, is there a difference between a radiologist and a radiographer?
Absolutely. The radiographer is the individual who has been trained in radiology, but specifically for the diagnosis using X-rays in different modalities of using X-rays. And that involves a long list of things. And then they go on to subspecialize, doing post graduation certifications in ultrasound, mammography, CT scan, and MRI. Those are subspecialties after you have attained a degree in radiography. So, radiography is the core treatment, training. But within that training, you have had an opportunity to explore all of these modalities, but you're not trained in them. And that's the reason why a radiologist is a key component, because he has had training in all of these modalities. The majority of radiologists, they are radiologists who are specializing in different things, but you have general radiologists who are equipped to interpret and report X-ray, CT scan, mammography, and MRI. So the radiographer is a technologist, but radiographer is used in the British sense. In the American sense, they say technologist. And
Well,
in the UK, a radiologist is a doctor. He is a medical doctor who has been trained, a subspecialty training in different disciplines in medical imaging.
well, clinical specialist sonographer Sonia Charles, you've had me listening with rapt attention. I've learned a lot, and this now, is an issue that's been again brought to the fore. And I think a lot of us, as ordinary citizens, and also people in the medical field and people in administrative positions, decision makers, policy makers, etc., would be clearly paying a lot of attention to what we've heard from you in this edition. Thank you so much for taking the time and going through all of that for us to bring the issue to the fore. Thank you very much indeed.
My pleasure indeed. Thank you. Bye for now.